And you know, when I went to go to some of the classes that they send you to before surgery, and I saw all of these poor old people in there in so much agony, you could just see it. We're all just in a lineup waiting for surgery. So, you know, 9, 18 months, 2 years, I've heard worse stories than that even.
Today, SecondStreet.org is going to talk to Alberta patient Kim Purdy about her really long and painful wait for hip surgery. But keep in mind that Kim ended up receiving surgery before COVID-19. And during the pandemic, governments across Canada put thousands of hip, knee, and other operations on hold. So that means that even more Canadians are going to have experiences like Kim did. Here's Kim's story and some information on potential solutions.
Around Christmas time in December of 2017, I was making Christmas dinner. I all of a sudden noticed this terrible pain in my hips. And it just seemed so strange. It was very sudden. I went to the doctor and I told him about this terrible pain. And so he sent me in for x-rays. And I went back to him to see what they said. And he said, well, there's nothing wrong. I turned into like an old woman overnight. That's how I felt, using a cane and all these things. I had no life at all. Just parking, I would drive around and around till I could find something that was close to where I had to go if I needed to get stuff. So my dog never got walked. Towards the end, you know, I would try with a cane or something because I felt so bad about him not walking, just to walk to the end of our driveway. And I was always scared, what if I can't come back? The second Christmas that I had this, I couldn't do Christmas. We didn't even have a tree, no decorations, nothing. I mean, it was like going into the dark ages.
As her condition worsened, Kim eventually was put on a long waiting list in Canada for hip surgery. As months went by, her pain got to be so severe that she came very close to paying for surgery in the United States.
I ended up calling Gateway Institute and went down there. And it turned out that that was going to come into costing me $40,000 to go to the clinic in Kalispell, Montana, to get this done.
Fortunately, after pushing our healthcare system, Kim eventually received surgery in Canada after a 14-month wait.
And it was sharp, excruciating pain immediately. Very strange. From that time to when I actually got the surgery was approximately 14 months of waiting to get this pain rectified and get my life back.
Canada's healthcare system has its strengths and its weaknesses, and one area where we need to improve concerns the long waiting periods to see a specialist or to receive surgery. Now, this is because each year governments decide how much they want to pay for different procedures. So quite often, they just simply make people wait. What other countries do, countries with shorter wait times than Canada, is they have a public healthcare system just like our country, but they also allow more private healthcare options. Australia, Norway, New Zealand, those are just a few examples. And what this does is that the private healthcare system takes pressure off of the public healthcare system. You can learn more about this in our new report at secondstreet.org.